when the Affordable Health Care Act was passed by the Obama administration and Congress, I was really elated because I had seen so many of my patients who came in and they were so sick because of lack of health care. They waited until it was really almost too late. So a lot of these people, if you didn't qualify for Medicaid, then and you worked part-time, you had no health benefits. So these were some of the people that I saw. So my book is focused on telling my story about some of these patients that I saw. But I start from the beginning when I was a little girl in Southern West Virginia, growing up in poverty. So I could really relate to some of my patients who grew up, who were in poverty, experiencing poverty. And I talk about my experience being exposed to domestic violence, sexual abuse, alcoholism, and desertion. My father deserted his family of 5 children and a wife when I was 11 years old. So my mother raised the 5 children. I was fortunate enough to get a scholarship to nursing school. That was my desire. Southern West Virginia was a coal mining town, and it was a coal mining part of the state. And Beckley, the city where I was raised, had coal camps, as they were called, all around. So Beckley was the city. And I grew up knowing about terrible mining accidents, and I talk about that in the book, about the miners who were exposed to coal dust and didn't have respirators. I also give some history of Beckley. Then I go on to when I became a nurse, and I talk about my marriage to my husband, who led me to Tuskegee, Alabama. And this is where my heart broke to see some of the patients who came into the hospital with no health insurance. I give specific stories about some of the cases that I saw, and some are very heartbreaking. But the one that broke my heart the most was when I saw a mother come in with this dirty blanket, laid it on the exam table and opened it up. And I saw a baby with severe malnutrition. You would actually say the baby was starving to death. Can you imagine that? This was in 1973. I cannot imagine a country as rich as the United States of America having children starving to death, but there it was in front of my eyes. So that was the most heartbreaking thing. Some of the women who were pregnant in Alabama traveled to Johnny Andrew Hospital 150 miles because they had heard that Dr. Foster, who was the OBGYN physician and had gotten a federal grant, they could come to the hospital and have their baby for free. Dr. Foster also went out in the community and gave free prenatal care. So they passed many hospitals which were segregated to come to Johnny Andrew Hospital to deliver their babies. So when I was working in the emergency room, I met them. Some of them had had the baby on the way there. So we had to establish emergency delivery kits and keep them in the emergency room. I also give a little bit of history about every area that I encountered. So I give the history of Beckley, and I give a lot of history about Tuskegee and other things that I experienced. I try to talk about the difficulty that African Americans experience, even getting a degree in nursing and getting a medical degree. I also touch base on some of the care that African American sisters and brothers got. Now, working in Alabama at John A. Andrew Hospital, which was considered a Black hospital, we saw a lot of patients from all over the state. But when I first got there, Congress had passed the bill for Medicaid and Medicare, but Alabama had not implemented it yet. So while I was there, I think the first year that I was there, Alabama passed the law so that people could receive Medicaid. So we saw a significant drop in the number of patients that we saw because Medicare and Medicaid paid medical bills. So they didn't have to drive all the way to John A. Andrew Hospital. But what they did, they went to these segregated hospitals where they had to wait in segregated waiting rooms and really got poor care. So unfortunate. Anyway, when I heard about the Affordable Health Care Act, I was just elated because I felt that so many of these patients would now not be afraid to go to the doctor because they couldn't pay. The unfortunate thing about the Affordable Health Care Act was when Congress and the Supreme Court got rid of the individual pay part. That was so unfortunate because that was, they said it was a tax, but it was mandatory that everybody have health insurance. What's wrong with that, having health insurance? So it's mandatory for us to have car insurance. So if you're in a car accident, your car gets fixed, but you can't get fixed if you don't have health insurance. Or you get fixed, but you're hooked for thousands of dollars in medical bills that some people can't pay. So that's really the story that I wanted to tell. And I wanted people to be sensitive to that fact. When they start talking about healthcare, it has a significant impact on all of us, and especially our brown sisters and brothers. I was able to experience a segregated medical service once in my life. I became ill and was visiting my family in Sumter, South Carolina. And I got sick, and the hospital gave me a doctor's appointment to go see this doctor the next day. So we went in the office, and there was this plush waiting room with soft cushions and sofas and chairs. But I was laying in the back in this hallway to sit on a wooden bench. When I saw the doctor, I was sitting in the waiting room and I saw where he had graduated from George Washington University Medical School. So I told him when I came in, I said, I'm a nurse and I worked at John A. Andrew Medical School. Worked at George Washington University Hospital. He turned red as a lobster. I apologize, Ms. Oxendine. He said, this is the way things are here in the South. Well, it's his choice. But our people need, we can see the statistics now on the difference in how people recover. So many studies have been done, and we need to take notice of those studies because lack of healthcare impacts our lives. It shortens our lives. And that's the story that I wanted to tell. And growing up in the United States of America, a nurse encountered starvation in the uninsured. No one in this country should be uninsured. No children should be starving to death. In the United States, as rich as this country is, it should not be. If anyone is interested in purchasing my book, it's available from the publisher, Dorrance Publishing Company in Pittsburgh, Pennsylvania. It's also available on Amazon. Now, you may not get it on Amazon. Amazon may tell you that they're out of it, but the publishing company has plenty of books. So just go to Dorrance Publishing, Dorrance in Pittsburgh, Pennsylvania, and click on bookstore. Thank you so much.